This is a social story on COVID-19 vaccine concerns in communities of color by Chicagoland DPOCC and Institute on Disability and Human Development. "2020 has been a sad year for many people. One reason why is because of the COVID-19 outbreak that affected a lot of people in the world, including those living in the United States. COVID-19 or the coronavirus is like getting the flu, but it's worse than the flu. Some of the signs of having COVID-19 includes coughing, shortness of breath, loss of smell and or taste, pain, fever, chills. As of March 15th, about 532,000 people died from COVID-19 in the United States, according to the Center of Disease Control, or CDC. Those numbers are continuing to rise. People with disabilities are at higher risks of catching COVID-19. Also, some communities of color are at higher risk of catching COVID-19. Fortunately, we have vaccines that can help us fight COVID-19. It is currently available for essential workers, people 65 years and older, and those who are at high risk for COVID-19, including people with disabilities. Soon, it will be available for everyone. Along with social distancing, including staying 6 feet from people, washing hands, and wearing something to cover your nose and mouth, like a mask. COVID-19 vaccines can help lower COVID-19 rates. If people play their role in keeping COVID-19 rates down, we can soon get back to doing things we did before the outbreak, like going to restaurants, watching your favorite band play live, going to festivals, and much more. While some are looking forward to getting the vaccine, others are afraid to get it for many understandable reasons. Some people fear that they will not have access to the vaccine in their local clinics. They may have to go elsewhere for the vaccine. But there is also a possibility that those places don't have the vaccine either. Some people feel that they could be discriminated and prevented from getting the vaccine because of their disability, race, gender, and other differences. Some people are afraid that doctors will use the COVID-19 vaccine to experiment on people of color. Some remember examples of doctors mistreating people of color in the past. For example, African American men in the Tuskegee study between the 1930s and 1970s were denied health care for syphilis, despite being promised free health care as a part of the study. Instead, doctors let the men go untreated so that they could track the disease. For more information on the Tuskegee experiment and other studies like this one, visit www.history.com/news slash the dash infamous dash 40 dash year dash Tuskegee dash study. Because the COVID-19 vaccines are new, there's not a lot of data and information on how effective they are in the long term, other than what is reported in trials. There is also not much information on how COVID-19 vaccines impact people of color with disabilities. Because of fear of being experimented on, barriers to getting the vaccine, and lack of information on how the vaccine affects people in communities of color, some people of color with disabilities are not willing to take the vaccine. However, according to data from the state, people of color in Illinois are more likely to catch COVID-19 than white people. If we want everyone to be safe from COVID-19, we must make sure that vaccines, protective gear, and COVID-19 information are available to everyone, including people of color with disabilities. Fortunately, Chicagoland DPOCC and the Institute on Disability and Human Development can help you get the tools you need to speak up and speak out on getting the vaccine, regardless of your race, disability, etc. Here are some ways you can learn more about COVID-19 vaccines, get access to COVID-19 vaccines, and encourage your community to get access to COVID-19 vaccines and other resources related to the outbreak. Ask your doctor if you can take the vaccine right now. In Illinois, people with disabilities who are at higher risk for COVID-19 should get their vaccines as soon as possible. People who are 65 and over and those who live in nursing homes and group homes can get the vaccine now. If you are looking for a place to get the COVID-19 vaccine, you can go to ilvaccine.org and search for available clinics in your area where you can get the vaccine. You can also use the site to see if you are eligible to get the vaccine in your area. Visit www.ilvaccine.org. Clinics cannot stop you from getting the vaccine because of your race, gender, disability, and other parts of your identity. If you see someone in your clinic who are trying to discriminate against you or people you know, speak up and speak out. If you're unsure about the safety of the COVID-19 vaccine, ask a doctor about its safety. Additionally, look at trustworthy and accurate news sources, articles, and data on the COVID-19 vaccine to learn more about the safety of the vaccine. You can also read or watch stories of people of color and or people with disabilities taking the vaccines. Use those stories to learn about their thoughts on the vaccines. Here are some examples of news sources you can go to for learning more about the COVID-19 vaccines. CNN, BBC, local news, Vice News, Al Jazeera, Politico, Upfront for Teens, or the New York Times, Reuters, Associated Press. Some people may be allergic to vaccines because of certain ingredients in the vaccines. If you are not sure what's in the vaccine, ask your doctor or a medical professional who are familiar with vaccines. Tell your doctor about your history of allergies before taking the COVID-19 vaccine. Because there are 3 types of COVID-19 vaccines, we will go over what's in each of those vaccines. You can also visit the following link to learn more about COVID-19 vaccine ingredients: hackensack-meridian-health.org/health-u/2021/11/a dash simple dash breakdown dash of dash the dash ingredients dash in dash the dash COVID dash vaccines. If you get the Pfizer BioNTech vaccine, it should have the following things in it: genetic material from COVID-19, salts, lipids such as oils, sugars. If you get the Moderna vaccine, it should have the following things in it: genetic material from COVID-19, acetic acid, that's in vinegar, acid stabilizers, those are things that make sure acids are as pure as possible, salts, lipids, such as oils, sugars. If you get the Janssen Pharmaceuticals / Johnson and Johnson vaccine, it should have the following things in it: genetic material from COVID-19 and adenoviruses, or viruses similar to the common cold viruses. Citric acid is in fruits, preservatives that keeps the vaccine fresh and liquid, salts, sugars, ethanol, the same alcohol that's in your beer, wine, etc. Through the Center for Disease Control app called vSafe, you can get frequent check-ins about how are you feeling after getting the vaccine. Sign up at vsafe.cdc.gov. For more instructions on how to sign up for vSafe, visit www.cdc.gov/coronavirus/2019 NCOV/vaccines /safety/vsafe.html. Ask your clinic or college to see if you can participate in research or messaging of COVID-19 vaccines for people with disabilities in communities of color. You can help those places spread the word about the vaccines. Encourage your legislators to create laws or make sure that their local area provide access to vaccines to people with disabilities in communities of color by writing to your legislators or talking to them either in person or through video chat. Share your story about getting the vaccine. You can use YouTube, a blog, or any type of social media to tell people about the vaccine. Telling your story can help people feel more comfortable getting the vaccine. Thank you. If you would like to know more about COVID-19 or the COVID-19 vaccine in plain language or in different languages other than English, you may check out the following resources on this slide.